Well, I'm waiting for something on the screen. Oh, there it is. Hello, we're live. It's Tuesday. It's 4 o'clock Pacific, 6 o'clock Central, 5 o'clock here in Costa Rica, 7 o'clock on the East Coast, midnight in Dublin, 1 a.m. in London and Milan and everywhere in between, 8:30 a.m. Wednesday morning in Australia, somewhere in the afternoon in New Zealand, and it's Facebook Live. So hello, everyone. It's really fun to be back with you. I'm glad we're here. And our guest today is my friend Carla Atherton. And I'm thrilled because I always just feel buoyant when I'm with Carla. So first, let me say hello and welcome, Carla.
Thank you so much for having me, Dr. Tom. I'm so excited. I feel the same way about you, so it's mutual.
Oh, well, thank you. So we're buoyant together. That's nice. That's really nice.
Yeah, exactly.
So I'm going to read Carla's bio just so you know who we have here. Carla Atherton is the director of the Healthy Family Formula and the HFF Practitioner Training Academy. She's the host and producer of the Children's Health Summit. I'm proud to be a part of that summit. You learn a lot about kids' health, a lot from her summit. Author of Family Health Revolution, family health consultant and coach, and children's health advocate. Spurred on by the love for her three glorious children, Carla's mission is to support families to achieve their best health through information, guidance, and empowerment. So that's the kind of person we've got here. So just welcome. It's nice to have you here.
Thank you. Thank you so much, Dr. Tom.
Yeah. So my first question for you is, was there something in your family's health that really spurred you in looking into family health? I mean, where did this come from?
Oh yeah, for sure. I think that most of us in this health arena have that experience, right? Where we just had something rock us out of our everyday kind of stupor of like, la la la, life is going on tickety boo, and then boom, there's something that you have to deal with. And that was definitely, actually, there were probably a series of those things that happened in my life. So there were some things personally, but the one that really got me involved and interested in functional medicine actually and family health was when, my daughter got a diagnosis. And actually, ironically enough, Tom, one of the first people that I heard speak that made a lot of sense to me about functional medicine and made me think, ooh, there's actually a reason why people, get type 1 diabetes, things like that. There's a reason, there's a root cause, and then there's some things you can do about it to actually improve health and not just kind of settle for a diagnosis. So that was you, actually. I listened to a whole bunch of talks from Sean Croxton, and you were a guest on his show like ages ago when the summits were just like very brand new. And I think you were just doing your gluten summit. And so I had reached out to your staff and I had started reading all your stuff and found out obviously gluten wasn't my friend. And a lot of people, and actually I've taken that and run with it. And I found that, a lot of my clients and kids that I work with have autoimmune conditions and autism and, all kinds of things that seem like these really big forever things. But all through my own experience. And that's why I wanted to start working in this field, because I realized that there was a whole world of stuff I wasn't told. We go to the hospital and, it's just insulin in and like isn't enough for the carbs that you eat. And that was not the case for us at all. And I knew that from that first day when I went into the hospital and the kid in the next bed was eating Fruit Loops. And I thought, there's something not right about this. There's something not right. And so that just sent me like just headlong into hours and hours and years of research. And then I just had to share it with people because that's kind of, gets to be in our nature, right? When we see something that works for us or something that we didn't know, and we'd like to help people to realize or, come up with their own solutions and be empowered by information, we just have to share it. So that's kind of a little bit about my story.
I got it. Yeah, thank you so much. And you obviously, and since the first time I met you, you're one of those that just has to share. You just want to make sure people know things, and you do it in such a non-threatening way. It's really great. Now, here we are at Facebook Live, and I always give shout outs here. And first one, Jennifer Whitley. Hello, Dr. Tom and Carla. Cindy's in Pennsylvania. Jill's in Anchorage. Thank you for doing these talks. Thanks, Jill. That's really nice of you. Jennifer's in Virginia. JC is in Pennsylvania. Errol's here. Hey, Errol. You did your scratch belly test and believe I have a histamine sensitivity. Do you recommend any supplements or special diets? Thanks. Well, no, the first thing is, why do you have a histamine sensitivity? And of course, you want to avoid foods that are going to give you more of a histamine reaction, and people's sensitivities vary, but you want to explore, where is this coming from? Why is my immune system on hyperactive? It's not a deficiency of quercetin that causes this, but quercetin will surely help, with some of your symptoms, but you want to ask why. Chris Lennis is here. Jennifer says, what would be some reasons for developing type 1 diabetes when I was diagnosed at age 14? Well, Carla, do you want to start with that?
Okay, so can you repeat that question, please, Tom?
What would be some reasons for developing type 1 diabetes when I was diagnosed at age 14?
Yeah, actually, there's such a combination. I call them the usual suspects for any sort of chronic condition, right? And I think that, there are multiple things, and I think that it's like when the bucket's full, it kind of overflows, right? So it doesn't necessarily mean that there's one thing or another. But I've seen things like infection, because it's all going to be, affecting the immune system, right? So hyperactive or, immune system, or I guess that's kind of the best way I can kind of put it. But, I've seen infection being involved in that. I've seen food sensitivities being involved in that. So, activating the immune system. I have seen like mental, emotional stuff, like high stress, poor diet. And that's not going to lead to like type 1 necessarily. But if we think about all of those things in our lifestyle or chemicals in our environment, things that are assaulting us all the time, or just not getting the right nutrients, or maybe even a vitamin D deficiency, all those things can be wrapped up into this situation where the body is actually, moving into the state of autoimmune. So there are quite a few things, but I've seen, like specifically an allergy or a sensitivity to dairy. And like in particular, casein A1B, which has a cross reactivity with the beta cells of the pancreas. So these are some of the things that I've seen happening for kids, that age. And you think, well, it's just sort of spontaneous. Why would you just get it? Well, there's a whole bunch of those usual suspects that I'm always looking at, and then trying to figure out what that combination is. And of course, the gut, right? Like if you've got a messed up gut, that's one of the triad. Or now you talk about, Tom, like 4 things that lead to autoimmune conditions. So we want to be looking at the gut too, making sure everything's working there. We don't have a leaky gut, right? So
Right.
lots of things. Yeah. So whenever I'm working with people, that's what I look at, is that whole host of usual suspects. What are the toxicities? What are the deficiencies? And how do we get that immune system kind of behaving itself, or just not having to work so hard and create this state of autoimmunity?
Right,
So
right.
that's where I'd be looking.
Yeah, thank you. Yeah, Jennifer, Carla's answer is right on the money. There are many triggers. I want to say a couple things to your question. When you were diagnosed at age 14, well, that's when there was enough tissue damage, which eventually causes dysfunction. And the dysfunction goes on for a while, and you can't figure out why it's there. But it keeps going on, more tissue damage, until finally you get symptoms. And those symptoms, you ignore them for a while, and then you finally are taken to a doctor if you're like 14, and if they do a blood test, you got diabetes. Well, you got diabetes when the antibodies to your pancreas first got elevated. It just wasn't symptomatic diabetes, but it takes years of those antibodies killing off the cells of your pancreas that make insulin, killing off the cells of your pancreas that make insulin. A very common cause is what Carla referenced, some of the proteins in milk. That the immune system, if they fight those proteins in milk, because those proteins look really similar in their protein structure, the antibodies to milk will attack the beta cells of your pancreas. And you start drinking milk when you're an infant, right? And first this is minor, but then it keeps going on. And so you're fighting it. If your immune system's fighting it, and if you carry the right gene for the vulnerability, the molecular mimicry is with the beta cells of your pancreas, and boom, eventually you get diagnosed. So it's I love it when we can get our hands on type 1 diabetics that have been diagnosed in the last couple of years, because it's easier to completely reverse them, because they still have some pancreatic function. They do. And for those that are older, you can certainly reduce the need or the amount of insulin that you need, and you can get your blood sugar regulating system working better. And that's always preferred because diabetics have a shortened lifespan. Bottom line, they die early, and they may have a decent quality of life for most of their life if they stay on their meds to keep their blood sugar stable, but their lifespan is shortened. And so anything that you can do that makes sense to follow what Carla said, why did I get this? Why did and you find, oh my gosh, dairy, I'm sensitive to dairy. Well, I feel fine when I eat dairy. Well, here's the test results. Your immune system is fighting it. You want to argue with this, right? You just have to do the right tests. And when you do, it becomes obvious. And then it's kind of like a come to Jesus moment for some people. But I was born and raised on it. And Carla's dealt with this with so many people, where it's just shocking. Carla, what is your approach when someone is just shocked that they're sensitive to dairy? As an example, dairy.
You mean shock, like as if like I didn't have any symptoms? Well, I always look at like, well, what are the symptoms? Because I mean, the thing is with something like, molecular mimicry, it's firing off, it's killing off beta cells. You don't feel that. You can't feel that. You don't have a rash. You don't have, something itching. You don't have you're not sneezing. You're not like feeling sick. It's like what people think, when diabetes, type 1 diabetes comes on or whatever, like you get this, you don't catch it. It actually, like you said, it's been years in the making, and all of a sudden it's like your pancreas is like, nope, not like I can't make enough. And it feels like it's a really sudden onset, but it isn't. I want to actually come back to something you said, because I wasn't actually intending to use this as an example, but when we did some testing, actually, finally, I knew that this was an issue, and I actually took her off of gluten and dairy right off the get-go at 11 years old. This was 9 years ago. But then it didn't last through the teen years. And I was like, well, there's something you got to get off, got to get off. And it wasn't until a couple of years ago that we were actually able to do a proper test, because I was twigged onto the right company that did a nice zoomer, right? Like it was a good test, and it showed sensitivity to casein A1B for my kiddo who was type 1, right? And my jaw dropped, and I knew all those years that there was this issue, right? And so when you get the test, you're so right. It's that come to Jesus. I knew, but I needed proof for other people to support me in that, right? Look at the test. This is the test. This is the test. This is like if it's in the red, don't eat it, and it's correlating. So what I help people to do is put together all those pieces. That's what functional medicine does, right? Puts all those pieces together and then go, oh, this is what sort of caused that. And this is what's caused that. And this is how we can rebalance this and shift this way. And that's what I help people to do for themselves, right? With that information. Had I had that information, I knew, but the testing does really help. And ironically enough, this is really interesting. I don't know if this is really relevant, but when I was pregnant and nursing and my daughter, the same daughter, I had this crazy craving for like whole milk, and I drank a ton of it. And I don't know how much that has to do with her future health, right? Because I was like drinking it like I was some kind of baby cow. I probably shouldn't have been doing that, because I actually reacted to milk too. So that's another thing. What's the health history, right? What went on with mom's health, what, at the birth, and then all through life, it completely affects everything that comes down the road. So if we can unravel all that, we have such a good chance at, like you said, reversal or at least significant improvement. And that's what I talk about in the book.
That's marvelous. Thank you so much for that. That's really comprehensive. And that's exactly what happens. some of you have heard me tell the story before of the study on pregnant women, 346 pregnant women in Chicago. They collected urine and they tested them. This was in the 8th month of pregnancy. They did urine tests to see how many phthalates they had. And phthalates are plasticizers, chemicals used to mold plastic. And they checked 5 phthalates, just 5, there are hundreds, but they checked 5, including bisphenol A, BPA. And they categorized them into fourths, the lowest fourth, the next, the third, and the highest fourth. And they followed the offspring of those pregnancies for 7 years. And when the kids turned 7 years old, they did Wechsler IQ tests on them. And what they found was that every child whose mother was in the highest quartile of phthalates in urine in pregnancy, compared to the children in the lowest quartile of phthalates in urine in pregnancy, every child in the highest quartile, their IQ was 7 points lower than these kids. 7 points, and that doesn't mean anything to anybody until you know that a 1 point difference in IQ is noticeable. A 7 point difference is the difference between a kid working really hard, getting straight A's, and a kid working really hard, getting straight C's. This kid doesn't have a chance in hell because mom was high in phthalates and she was healthy pregnancy, but she was high in phthalates. Now go to Google and type in phthalates, PHTHALATES, and neurogenesis, nerve growth. And you see that these plasticizers inhibit nerve growth. So if mom is high in phthalates because she's eating leftovers that were stored in plastic storage containers in the refrigerator that leach phthalates into the food, or mom uses nail polish and the phthalates leach into your bloodstream in 4 to 5 minutes, and mom's been doing that for 25 years of nail polish, and this minor amount of phthalates accumulates in your body and accumulates in your body and accumulates in your body for 25 years. Now mom's pregnant and she has higher levels of phthalates. Baby's brain is not going to develop properly. Every child whose mother was in that highest fourth. Why am I telling you all this? Because it's the same concept if you're sensitive to dairy.
Right.
That dairy can inhibit brain growth, brain generation, but especially if you fight dairy, the most sensitive tissue, arguably, is the brain, but the second most sensitive tissue is the beta cells of the pancreas. So you fight dairy, you feel fine when you eat it, but your body's fighting it. And those antibodies, because the beta cells of the pancreas look similar to the proteins in dairy, those antibodies go after the beta cells. And it takes years. You rarely diagnose a 6-year-old with type 1 diabetes, rarely, or an 8-year-old. Usually, eight's about when it starts. 8, 10,
11,
12, 11, 14. That's when you see it because it takes that many years of killing off cells, killing off cells, killing off cells, until there's not enough cells that are being produced. You're killing them off faster than you're producing them. So you have a deficit of beta cells. So you can't make enough insulin. You get diagnosed with diabetes. So I'd strongly suggest you read my book, The Autoimmune Fix, because it's all laid out there. All of this geeky stuff we're talking about is laid out over 300 pages or so. And it won the National Book Award. It's a good book, and it explains this concept really well. Thank you, Carla, for that. Thank you. I got to give a shout out here to Gwendolyn in New Zealand. She says it's 1 p.m. on Wednesday in New Zealand. Thank you, Gwendolyn. Good to know. Hopefully I'll remember that. Dorada's in New York. Debbie's in British Columbia. Kat's in Kentucky. Leanne asks, what's the difference between wheat sensitivity and gluten sensitivity? Wheat has many different components in it. The parts that make up what we call wheat. There are many different components in it. There's a family of gluten proteins, and one in particular that's really common to be tested for that can cause a problem. But there are 62 different components in wheat that have been identified that the immune system can fight. So commonly we identify they're fighting the gluten, but it could be the amylase trypsin inhibitors. It could be the omega-5 gliadins. You know, there are many different things that it could be. So a wheat sensitivity, it's a really good question, is the bigger kahuna that includes gluten sensitivity or amylase trypsin inhibitor sensitivity or arabinoxylans in wheat I'm sorry for the geek words, but just understand there are different components in wheat. So, and the proper terminology really should be wheat sensitivity, not gluten, unless you test in specifically. But the whole world talks about gluten, so it's easier for people to understand when you say gluten. A shout out to Agnieszka Dobrolowska. I'm sorry, I don't know how to say that. My wife's Polish. I'm supposed to be able to read this, but I'm not doing a good job. Sorry, but thank you for watching. Amy Quick says, hi, Carla. Hi, Dr. Tom. Amy from
Hi,
Glenview.
Amy.
Hey, fellow type 1 diabetes mama. Hi, Amy. And of course, you know, I spent 24 years in Glenview, right behind Walker Brothers. Shanquil says, hi, Doc. What are reasons for low elastase or low secretory IgA on a stool test? What the heck do you do for this? Really good question. The reasons for low elastase is a enzyme production. You're not making enough enzymes. That usually comes because of inflammation, usually. So, you know, the question is, where's the inflammation coming from? What is it that I'm putting down there that's causing the inflammation? Low secretory IgA, that's the first really first responder when we're exposed to something coming in through the mouth that's a threat. Secretory IgA grabs onto whatever it is and locks it up so that it just goes all the way through the tube and out with the bowel movement. That's the job of secretory IgA. And we make a lot of that every day. I saw one study, it was over a teaspoon a day of this stuff. I mean, that's a tremendous amount because we're always fighting what we're taking in. We're breathing in, and sometimes, you know, you swallow during the day, you know, and you breathe a little through your mouth. And then of course the foods we're eating and the beverages we're drinking. But secretory IgA is, when it's low, you're most likely it's a wearing out process. It could be a genetic thing that you were born with, but that's very unlikely. You could be genetically sensitive, but usually it doesn't show until you've worn out that tissue. So the question is, how are you wearing it out? And it's almost always the same, it's inflammation. So the question is, where's the gasoline coming from on the fire? And as you hear Carla say, you know, it's always inflammation that she's looking for. So Carla, tell us about your new book that's just come out. Tell us about that.
Okay. Well, actually, it's kind of interesting because when you were talking before about the causes, because that's what I do a lot in the book, is that I help people to pinpoint what those usual suspects are. And then I talk a lot about solutions to those particular issues. So it's like, what is that? You know, how do you correct deficiencies or rebalance or you know, eliminate those lifestyle factors that will actually create these toxicities. And then if you're already toxic, let's say, you know, you have phthalates, you know that, you want to prepare for having a baby or something like that. And how do you get rid of that? So I talk about those things, those sort of practical kind of hands-on things, but a lot of the book is about that whole piece of that human piece. Like, you know, how do you actually do this? Like, how do you don't really, you know, work with the individual. You talk about the family because families are a unit and families are the place where you find healing or we find strife or, you know, all those things happen within the family. So we don't have the sick kid. We don't have sick grandma. You know, we have this whole family unit that can embark on a beautiful health journey together. And make change for all of them. So I think, you know, the health of one person affects all the others. It's also my story too, woven in there. you know, with examples and, you know, places of like aha moments that I had, right? That I went, oh, other people need to know this. Oh, other, you know, so it's almost like, you know, how you were talking, Tom, about the like these, you know, these health issues like phthalates, and then the brain, and how the brain doesn't develop properly if the mom has phthalates. Well, we're producing a program out of the book, right? So there's some beginner stuff in the book there, helps you to get started on things like that. But then we have a program called Healthy Mama, Healthy Baby that we're going to launch in June, because I would have wanted to know that. Like, I dumped all that stuff into my firstborn, my poor son. And, you know, because I grew up in the 80s, talk about bags, boxes, and cans, you know, like that time of life, like, you know, I mean, it's probably just as bad, maybe worse now, right? But, you know, that's when we really started full on to that really poor junk food, sad diet, lots of chemicals. I used to go home at lunch and eat, like, you know, those Ichiban noodles, like those, you know, those kind of fried, and then they're like dried. And then they have that MSG sauce. I didn't even cook it. I would crunch it up, leave it in the bag, put that MSG all over, and eat it with a spoon. So gross. And like, so, I mean, I came a long way. Like, you know, I was interested in sports, and I was interested in my, you know, like making my body feel better. So that kind of drove me into being more healthy, right? But I wasn't taught that. My culture didn't teach that. So I talk about all that stuff in the book, like our, you know, mental, emotional health too. I don't miss that at all, because we could look at those root causes, and we can look at those things we did wrong as parents or we didn't know. But I want people to know, because once they do know, then they have more empowerment to actually try to prevent, right? Or to maintain health, because we would rather be maintaining health than reacting to poor health, right? And also to know what happened, not to feel guilty, because I'm one of those moms too, that I did these things and I see the decisions that I made affected my kids, but I can't live there. Like, and I don't want any parents reading my book to live in that space where you feel guilt, where you feel like I did this wrong, or like, you know, I can't do anything about this. No, the whole book is about empowering through information, good quality information, even cutting edge, you know, where we're not like talking about this in the mainstream, we're talking about it in our circles, Dr. Tom, because this is really what we're discovering right now is the real root of health: the immune system, reducing inflammation, gut health, the gut, you know, gut brain communication, stress, reducing stress, right? Like, and all of those things are stressors. So if we can reduce the stress on the body, everybody in the family wins, right? So that's what it sounds like, a whole bunch of stuff I'm throwing at you, but I really have put it all and organized all that stuff into one place where people come out of it, I hope, to feel empowered with information and some, like, in a reference book, right? With ideas on how to make that happen, right? Whether it's like a chronic condition or like, you know, really kind of very serious, like, you know, the stuff we've been dealing with or have dealt with. You know, so they could be serious all the way to just want to just get a little better, everybody lose a little weight, get a little closer as a family, get outside more, you know, all that stuff. Like, there's inspiration and information for all of that.
That's fabulous. That's really fabulous. And we'll put the link here for you, for everyone, so that you can order Carla's book, you know, and if you pick up just one idea for you or your kids, or your family, just one that you implement, is it worth 15 bucks or 19 bucks, you know, whatever the cost of the book is? And, you know, absolutely. Absolutely. Let's support Carla because she's pure of heart and pure of message. So order the book, you know, pay it full. Well, I don't want to read another book. All right, order the book anyway and put it under your pillow, you know, and you might get some cosmic energy, right? Right. That's going to come.
The intent is there. The intent.
That's right. That's right. So Al asks, can leaky gut make you histamine sensitive? Absolutely, because macromolecules are absorbed. They cause inflammation. That can fuel more of the histamine. But histamine will also cause leaky gut. There are papers showing the high histamine people that histamine will interact with the epithelial lining of the gut and you get more leaky gut. So it's a cat and mouse, chicken or the egg kind of thing with that. Kat said, Dr. Tom, I know if I'm saying this correctly. No, I don't know if I'm saying this correctly, but you've said a few times that if we take gluten out of foods, then we need to replace it with blank. And really good question, important to remember this. that when people go gluten-free, which is a smart thing to do and can radically change the direction of your health for many people. I never say everyone should go gluten-free because I'd sound like a fanatic. I say everyone who has a health condition should check and see if their immune system says you have a problem with wheat. And that test is the wheat Zoomer. There's nothing else in the world like it. I lecture all over the world. I see the labs and what their offerings
Yep,
are.
I love that one. It's an awesome test.
No technology anywhere in the world that matches that. So you do the wheat Zoomer, and so you check, and if you're positive, then absolutely you get off of it. But when you get off of wheat, the problem is that 78 to 80% of the prebiotics in the Western diet come from wheat. They're called the arabinoxylans in wheat. What does that mean? Prebiotics are the things that feed the probiotics, the good bacteria in your gut. You don't feed them, they die, right? So 80% of all of our prebiotics in the Western culture come from wheat, because wheat is on a teeter-totter. There's some really good things about wheat and there's some not good things about wheat. The problem is, as you lose tolerance for many different reasons, the not good, so good things weigh more and more and more. And now you got a real problem and you have to get this out of your diet. You've got to get it out of there. But when you do that, the good guys, they're gone also. The prebiotics are gone also. And that's why you have to focus on prebiotics in your diet as you're transitioning gluten-free. Critically important. Root vegetables, go on Google, type in list of prebiotic foods, print it out, put it on your refrigerator, have at least 2 of them a day with a root vegetable every day, eat a little applesauce every day, homemade, not commercial, and those things will just help to feed the good bacteria in your gut. Quincy.
Okay, so Dr. Tom, if you're going to the next question, I'm just going to close my curtain. I don't know if you noticed, but the sun is rising on my head. Soon you won't be able to see me. I'll be this glowing blob. So while
She's elevating. She's elevating. Yeah.
While you're answering that, I'm just going to close that curtain. Okay.
Of course.
Okay.
Quincy has a question. My 62-year-old mom was diagnosed with interstitial lung disease. Best answer she could get. They say she has scar tissue on her lungs, not a smoker, and it will only get worse. She's at 40% lung function and on oxygen. Is there a way to reverse this? There is a way to arrest it and sometimes improve function substantially. I don't know about completely reversing it, but yeah, there is. How? Everything that Carla's talking about, everything that I'm talking about. Interstitial lung disease means you got lungs that are scarring up. That's not a diagnosis, that's an observation. And it comes from inflammation targeting your lung tissue. So it scars up. Now you may be genetically sensitive to your lungs having that. Somebody else is genetically sensitive to their liver having that. Somebody else is genetically sensitive to their joints having that. But it just depends. But it's this inflammation process, Quincy. So the first thing I'd recommend you do is get my book, read the book, and understand that where all of these external factors come from, and then find a doctor who knows how to work with this so that your mom is getting comprehensive guidance. Don't go to somebody that's just starting out and learning a little bit, because she doesn't have a lot of time to mess around and let this thing continue. So you go to someone who's certified in functional medicine, someone that's been out in practice for 20, 30, 40 years, someone who's got a great reputation for functional medicine, something like that. She can work with my team here at theDr.com. We deal with this kind of stuff without a problem, but she needs someone. And what you can't, there's no pill that's going to stop this process. Some pills may slow it down a little bit, but that's why they say it's just going to get worse. That's why they're telling you that, because they don't know what to do to stop the process, because they're not trained in functional medicine to stop the inflammatory cascade that's causing this. So that's the answer, Quincy. Robert says, any relief suggestions for Ebstein-Barr? Well, viral infections, everything you do for viral infections. We've had a couple of Facebook Lives on that with this pandemic we're in. Not going to go through all of that right now. You can go back and look at one of those. Do you talk about Ebstein-Barr in your book?
I touch on it. I'm not explicitly, but I do talk about viruses, and I talk about like the virome and making sure that there's balance, because that's really the key. Like to me, it's more about balance rather than eradicating this and punching down that and fighting this. It's more about maintaining balance in the virome and the fungal load in the body and the microbiome, right? Because we need some of these to keep these in check, so we need more of the beneficial. But there's still a role for certain viruses because they keep others in check. So, but we do want to, get ahead of them, right? We don't want to have a big plethora of, Epstein-Barr kicking up, and then you have all these problems. So my whole strategy is to actually improve the immune system, right? So, and there's like a handful of things that are really powerful. And I know it's supplements, or it's diet, or it's exercise, or it's rest, or, all those things that, are lifestyle interventions, but also some supplements are actually really useful, I think, too, like, vitamin D, because a lot of times if you're having trouble, with your immune system, you could have low vitamin D. And so you could get your vitamin D levels checked, or just take a bit. That's not going to knock out Epstein-Barr, but it's certainly going to help your immune system to work better, so that, because the whole point is that you want your body to do what it's supposed to do. You want to support your immune system and reduce inflammation, right? You don't want it hyperreactive. You don't want it under responsive. So how do we do that? So we balance, right? And then we target a couple other things, that might be specific to certain viruses or places where those viruses are, even, because there's so much to know about that that's even outside the realm of functional medicine, that even, that we know of that can be really useful. But it would really have to be, so what I do is I look at like a good health history, right? Because we want to know what that recipe to bake that cake is for you. So I deal with Epstein-Barr like I would with any sort of virus. I like antiviral herbs. I like supporting the immune system and all those lifestyle factors that will reduce the stress on the body so that it can do its job. We want it to do its job. We don't want to do anything that's going to hinder that process.
Amen. Amen.
Yeah.
Shanquilla asks, can you tell me why it says diabetics shouldn't use Epsom salts on the bag? I've never seen a problem or heard of a problem, Epsom salts in a bath, but diabetics often do foot baths, and they pour a lot of Epsom salt in there, and it changes your mineral concentrations in your skin when you have high concentrations of Epsom salts in the water. And diabetics are prone to foot infections that progress pretty easily because there's not much blood flow. The blood vessels are constricted. And so you don't want to alter the permeability, if I can say it that way, of your feet by doing foot baths with lots of Epsom salts in them. That's the only problem I know of for diabetics.
Dr. Tom, what about this? This just popped in my head. This is how my brain works. I don't know this. Okay. So this is when you start thinking in this way, right? Like you and I are talking about like dysfunctional, like what's the cause? What could be this? What could be that? What about if a lot of diabetics have trouble with their kidneys, and the minerals actually are hard on the kidneys when you have a malfunctioning kidney? Could that be something that's going on there?
That's really a good observation on your part. The answer is theoretically yes, but most people have magnesium deficiencies, and if they put a cup of Epsom salt in their bath, it's not going to throw their minerals out of balance and tax the kidneys. But the concept is correct. If you were,
but maybe that's why there's that warning, because that's an ignorance, right? That this is not going to actually do that. But that, we don't want to have too many minerals, but actually we are mineral deficient in the first place. But it could be they're warning you because they think that this could happen.
Yeah, well,
I don't think it would.
Well, the warnings explicitly are for the feet and foot baths.
Uh-huh. Uh-huh.
not Epsom salts in a bath. They'll
Okay.
categorize it in the bath, but when you say, well, show me why, and where's the science on that? It's foot
Right.
baths. And
Right.
then they extrapolate it to all baths because most people are way out of balance in their minerals anyway. And so they're making a
Mm-hmm.
judgment call, but my patients are not that far out if they're staying my patients. Uh,
Right.
Cheryl, Cheryl asked, how important are bioflavonoids? They're really important, Cheryl. It's the rainbow diet that we talk about as part of the antiviral program right now with this pandemic that we're dealing with. And they're critically important. Bioflavonoids, one of the things they do is they help to inhibit this virus from binding onto the receptors called ACE2 receptors. And that's the receptor that the virus gets inside your cells from. It's like the door inside the cell. There are many doors to get inside your cells, and the virus goes to ACE2. That doorway opens the door and goes in. And viruses in the bloodstream are not that big a deal. It's when they get inside your cell because they don't shed in your bloodstream. That the science says that viruses shed when they're inside your cells. And viruses don't reproduce, they don't divide, they just like have dandruff. They shed off, and then all of a sudden here's a new little virus, and then it sheds off, and there's a new little virus, right? So it's a shedding process, but they shed inside the cells. So they've got to get inside the cell. And to get inside the cell, they have to go through a doorway. And the doorway that's identified is the ACE2 receptor. And bioflavonoids fill up the ACE2 receptors so that the virus can't get in. So that's just one example of how important the bioflavonoids are for you. Carrie asked the question, I just received a positive ANA test with a speckled pattern. No diagnosis yet. What's my next step? I'm reading your book and have learned so much. Thank you. Oh, thank you, Carrie. Okay. Some people have heard me say before that I'm shocked by these studies. 20% of apparently healthy people have elevated ANA antibodies. ANA is anti-nuclear antibodies, means a nucleus in your cell, that your immune system is attacking the nucleus in your cell. What cell? Every cell, any cell. It just depends, but it's ANA. And 20% of the population has been found to have elevated ANA antibodies, and they've got no diagnosis. But those people in the studies, and about 400 or 500 people, when they follow them, within 3 years, 87% of them are diagnosed with an autoimmune disease. They're healthy, but they've got elevated ANA, meaning the antibodies are attacking inside your cell, the nucleus, the center of it all. The antibodies are trying to attack that inside your cell. 87% of those people have diagnosed autoimmune disease within 3 years. What autoimmune? Depends on your genetics as to which one, rheumatoid, lupus, scleroderma. It's mostly been the connective tissue diseases with ANA, but that's what happens. So the question is, okay, I've been found to have elevated ANA antibodies. What's my next step? Your next step is to find out what is buried inside, deep in your cells that your immune system's trying to get at. Mercury goes into the nucleus of the cell. There are lots of petrochemicals that go into the nucleus of the cell. So if you accumulated mercury because you've been eating canned tuna fish twice a week for the last 7 years, and you got high mercury levels, because all tuna fish except Vital Choice, and let's post the link for Vital Choice. It's the best seafood on the planet, safest seafood to get commercially on the planet.
Buy that.
1 can of their Ventresca tuna fish has 7 grams of fish oils in them, 7,000 milligrams. So if your kid eats 1 can of that tuna fish a week, it's mercury. They can't say mercury free because you can find anatomic levels or atomic levels of mercury in there. So they say low mercury, but that's their Ventresca. 1 can a week, and your kids got more than double the raw material to make all the brain cells they're going to make that week. So critically important. So Ventresca is a great tool. Do you talk about that in your book in Feeding Kids?
Yep. Yeah, we talk about all that. I talk about the diet, the rainbow, ratios, like food sensitivities, challenges with food sensitivities, how to meet those challenges with food sensitivities with children or with older people. Like I talk about all of it from the actual recommendations to the practicality of making those changes with your family. Yeah, talk about all that. I have a huge section about food.
That's what I love about your book, is that it's a mom-written book. It's not
Yes, it is.
it's not a geeky science book. It's like, hey, this works. This is what works. And here's the reason
And this
why.
doesn't work.
Right.
Yeah.
Let's see. Errol asks, can you eat black rice if you are gluten sensitive? Yeah, but you cannot if you are rice sensitive. I mean, people can be sensitive to anything, but in terms of the toxic proteins of gluten, they are not found in black rice. As far as I know, they're not. There is gluten in rice, but gluten's not bad for you. Bad gluten is bad for you. And that is the families of gluten in wheat, rye, and barley. Those are the ones that you have to worry about. Okay. Amy says, I'm trying to reverse my daughter's type 1 diabetes over here. Oh, this is Amy in Glenview. Well, good job, Amy. Be in touch here with Carla, right? Get the book. The link should be here now for the book. Amy says, my daughter was diagnosed 4 years ago at the age of 16. We did Vibrant testing. She is gluten, dairy, and egg sensitive. So to a parent, that's a big surprise. To a functional medicine practitioner, of course. That's like 101 stuff that you have to do, but it's hard to get people to understand, because wheat is the staff of life. I mean, that's what we've grown up with, and you have to get sick enough before you're willing to listen. Bottom line, for most people, that's what happens. Amy says, my daughter is maintaining low 5 hemoglobin. I think that's hemoglobin A1C. So proud of her, low 5s. That's normal. So that's a type 1 diabetic that does not currently have type 1 diabetes. Now she is a type 1 diabetic. She was diagnosed with it. That's the weak link in her chain, but it's in remission. Well, can she go back and start having banana splits? And of course not. Of course not. Her body has already demonstrated, that can't handle this, man. Can't handle it. Congratulations, Amy. Way to go.
Yeah, good job. Can I say one thing, Dr. Tom? That's another thing that comes out of this book, is that we do a lot of programming through my Healthy Family Formula. And that's one of the programs that I've been developing and actually run it a couple of times, optimizing the health of children with type 1 diabetes. So that's another thing that, Amy, love to see you in there. We've been talking for a while, actually, Amy and I, so we're kind of like friends, friends on Facebook and stuff. So I would love to see her there. But yeah, so I just wanted to just send a little shout out about the support that's there for this, because I think that especially when these kids are newly diagnosed with something like that, I mean, diabetes is something nobody even wants to touch. Like you hear in the media, even MS or Hashimoto's, those conditions, they're autoimmune as well in nature, but you actually are starting to hear in mainstream of them being, not even necessarily mainstream, but closer, that they're being reversed, or that there's maybe, an element of maybe like Lyme disease or some kind of mercury toxicity or something. And people are starting to twig onto the fact that if they clean all that stuff up, their autoimmune conditions can be reversed or significantly improved. But you don't hear a lot about that with type 1 diabetes. And I want to say that that's not the case. I mean, it's actually, there's a lot that can be done. And so that's why I wanted to, educate people in that, because I don't think anything's really, there are very few conditions that are untouchable, right? There are very few, if you understand how to get to root causes and resolve them. And, you know, I think that there's, yeah, so that's one thing I wanted to do with that program. And the book itself, it's like very integral to the program to get your head around this concept of like de-medicalizing our health, returning to the natural state of health, that we actually should have a default of good health without riddled with all of these conditions that we're seeing like cropping up. It's like, I don't even know. Do you know anybody who doesn't have a condition? I mean, I think even acne is a condition, right? Like it's still a chronic condition that we like looking at the gut, what's going on inside, right? So I just wanted to say that about that program, because this is my mission, is to educate parents and caregivers and just families in general, even for their own individual knowledge, that there's so much that you can do for these kinds of conditions that we're not really being told about, but there's just a world of healing out there.
Yeah, you bet there is. Thank you for sharing that. Amy
Yeah.
says, funny enough, I have no issues with dairy. Well, Amy, if you've not done the dairy Zoomer, you really can't say that. You certainly can have things going on that just haven't built up to the point of diagnosis yet. But if there's a family history, if your daughter is a diabetic, either you or your husband or both of you have that genetic vulnerability. So you may be manifesting it in such a way that you've got elevated antibodies to your joints or elevated antibodies to your brain. You know, this wouldn't relate to you, but to see the correlation with the protein casein in milk, just Google casein and sudden infant death syndrome and look at the science. He's what? So dairy can affect your brain and you may not be noticing it unless you've done the dairy Zoomer. If you have, then okay, then I'll agree with you that dairy doesn't seem to be an issue. Jennifer says, I would love to try to reverse my type 1 or see how much I can reverse, but it has been so many years. Well, Jennifer, you have an entire new body every 7 years. Every cell in your body regenerates except your teeth, every other cell. So you're building a new body every day. You want to build a stronger body that's reducing your need for insulin and maybe not eliminating completely, but reducing the need and reducing the complications of taking those meds? Or I think you do. And you said you would love to try to reverse, but it's been so many years. So let me just tell you, it doesn't matter. You should get improvements. And the rule of thumb at theDr.com is 3 weeks. After we have all of our tests back and you're applying the protocols, if you're really applying the protocols, you should notice a change within 3 weeks. What does that mean? Well, it means maybe instead of your blood sugar being bad every morning, now there's 2 mornings where it's been good and then it came back bad again. But oh, and here again, it was good and then it came back bad again, meaning it's going to take time, but you should see some results within 3 weeks. I promise. That's the rule of thumb. That was the rule of thumb in my practice. That's a rule of thumb for us at theDr.com. Quincy says, hello, we just finished dinner here, so I'm hopping on a little late. Thank you for showing up for all of us. Oh, thanks, Quincy. Okay. Hope you had a good dinner and you chew your food.
Chew. I had to learn that.
Oh, that's actually a good exercise for everyone to do. It comes from macrobiotics. That was much more popular in the 70s and 80s and still around, but not getting as much press. But chew your food 30 times. And I encourage everyone to do that, to try it. Just try it. What does that mean? It means you count 1, 2,
yep.
3, you know, count 30. And notice that the taste of the food has changed, that the ptyalin and the amylases in your mouth, in your saliva, break down the carbohydrates. And so those carbohydrates, as they're breaking down, they taste sweeter. So the result is your food tastes sweeter when you're chewing it enough. So that's a wise thing to do. Let's see. Kim says, is it common if a young child has an egg allergy that they are also sensitive to dairy and wheat if they show no other symptoms? Yes. Yes, it is. It is common.
I have to say, Dr. Tom, that I almost always run all of those 3 Zoomers for sure. If there's any sort of chronic conditions, those are 3 of the foods that I test. And I know those are the big, part of the top 5, right? So I talk about that in the book too, but it's super important. And I rarely see no issues with one of those 3 if there's a chronic condition. And I just want to add too, I know you're trying to get to another question. When, like, if you're talking about gluten, for instance, we've had all kinds of different conditions, like in our own, like just our nuclear family. We've had depression, we've had type 1. My dad has scleroderma. I had a bunch of connective tissue issues. I dissected carotid artery, spontaneous, where I had a clot. I could have died a couple years ago. And that actually, I think, is related to connective tissue issues, right?
Yes,
so I repaired myself from all of that because of my knowledge of functional medicine. I knew what to do. I did cold laser therapy. I did, fish oils. I did all kinds of stuff to repair all that stuff and make sure it never happens again. Thank you very much. But I want to say, like, a commonality. I also had hyper, like, joint issues and problems like with that. I was in a lot of pain, and I gained actually 35 pounds when I was 35, and I was a super active person. But so what was a common denominator for all of us was gluten sensitivity and dairy for actually most of us. One of us was like having we did a neural zoomer, and it was lit up like a Christmas tree with autoantibodies to all kinds of brain tissue, to blood-brain barrier, stuff like that. So it's very important to look at all those foods, and I see that actually, like, it's more common for those combinations to happen rather than not, right? Like, I see them more often than not. Yeah.
I agree with you. Gwendolyn says, when I was diagnosed with Still's disease as a child, I was fed copious amounts of milk and low-fat yogurt to help my bones. They were also pumping me full of steroids at the same time. Madness, utter madness. That's true. Very true.
I hate hearing that stuff.
Tina says, hello from New Mexico. Hi, Tina. Let's see. Robert's here from Albuquerque. Thanks for having the event. You're most welcome. And let's see. There was one last question from Saleha. Dr. Tom, what do you think of homeopathic medicines? Homeopathic medicines have been around for a few hundred years. They work exceptionally well sometimes. When they don't work, when you're seeing a competent homeopathic practitioner and the remedies are not working, one of the primary reasons why is that your body is a toxic sewage dump. That we have so many, every newborn child had 283 chemicals in their cord blood at birth that aren't supposed to be there. They're in mom's body. And mom's been storing these for 25, 30, 35 years, right? And so baby's getting all these toxic chemicals like the phthalates that I talked about in the pregnant women and the IQ. And that's been going on, that we are just toxic sewage dumps from all of the exposures that we have. Homeopathy is based on bringing a purity back to the response of the human body. And it's very effective. And for 150 years or more, it's been the primary treatment mode for many hundreds of thousands of doctors. But sometimes it doesn't work anymore. And when it doesn't work and you're seeing a good practitioner, it's because you're toxic. And you need to learn about detoxification and start including more detox in your life.
Can I just give another shout out to homeopathy? I have a giant cupboard full. Like, you would be like, what? I have a lot of homeopathy. I have sarcodes and nosodes and like just, like all kinds of stuff. So I've been digging in really deep, and I actually have a little section about homeopathy in the book too. And I talk about, and the efficacy, especially with children, because they're so responsive. So, and it's very easy.
Why are children so responsive? They're not as toxic yet. So, the homeopathy can work. It can, but it's in adults where it's more difficult to get these remedies to work sometimes.
Much more complex too. Yeah, and you totally need someone competent. But there are a few homeopathic remedies that are kind of like go-tos for things like fever or for, you know, mood or something like that. Like I like Bach flower remedies, right, for moods, and like fever, a lot of people go to belladonna, right? You know, so there's a couple, I'm not going to say recommending all these things for sure for you, but there are a few that are kind of like few that I picked as favorites for just kind of general things, but like for more in-depth stuff, I'm actually working with a homeopath all the time for my own health.
Yeah,
Mhm.
amen to that. Amen. Jennifer says, I can't wait to get the book and anxious to take the CGP course. Well, thank you, Jennifer. Welcome aboard. That's really great. That is really great. I see that we posted the link for Vital Choice for people. And I believe we've got Carla's book here for you to order. Please order the book. Just to support this woman in her work and carrying her message out into the world. And it's been an hour, so
I know.
it just goes so fast. It really does. So Carla, thank you so much for being with us. Your level of wisdom is greater than your years, and I know it comes out of an urgency being a mother that happened, and your dedication and perseverance. So way to go. And everyone out there, please order her book. Let's support this person and her chosen career as she raises 3 kids, right? So order the book. And if you pick up one thing out of it that you use for the rest of your life for you and your family, it was well worth the investment. So Carla,
I promise you it will be way more than one. Way. It's way more than one. So yeah.
Thank you so much. Thanks everyone. We'll see you next week. Bye-bye.
Thank you.